Well, good morning and welcome to the Iowa City Area Business Partnership Candidate Forum with State Senator Marianette Miller-Meeks. I'm Jennifer Banta, Vice President of Advocacy and Community Development. I'm your host for today. And on behalf of our members, thank you so much for joining us, Senator Miller-Meeks. We
Thank you.
appreciate you taking time out of your day. The purpose of today's forum is to provide a venue for our members to hear from Senator Miller-Meeks on her agenda and to allow them to ask questions as our business community struggles to keep its head above water during this COVID-19 pandemic. This election feels even more important than ever. So Senator Miller-Meeks is an ophthalmologist in Ottumwa, was the first female faculty member at the University of Iowa's Department of Ophthalmology. I always love finding facts like that, pioneering, paving the way for the rest of us. She is the Republican nominee for Iowa's 2nd Congressional District in the 2020 election. And I always just like to buzz through our policy priorities real quickly. The Iowa City Area Business Partnership and the Cedar Rapids Metro Economic Alliance work together for the good of our region. And we collaborate with over 2,000 combined member businesses, and other partners to advocate for policy that's vital to our region's success. And since the global pandemic, and now with a major disaster declaration due to the derecho, we have shifted our focus to economic recovery and continue to advocate for strong policy in regards to workforce development, business development, and community development. And the format of today's forum will include question and answers with Senator Miller-Meeks. Please click on the chat box to ask a question. We will answer as many questions as we have time for. This session is being recorded, so we will put it on the advocacy page on iowacityaria.com, and we will be pushing that out through social media at the beginning of October. The format of today's question and answer, please limit your questions to kind of business related topics. And lastly, just want to mention that web traffic is high today. Zoom is really zooming. So we keep our fingers crossed. I'm in a house where 4 people are using the Wi-Fi. So
Wow.
we'll see how this goes. And I hope that our Wi-Fi stays strong. So with that, Senator Miller-Meeks, thanks again for joining us. I'd like to give you some time to introduce yourself and tell us more about why you're running and your ideas for recovery.
Well, thank you very much. And I want to thank the Iowa City Business Partnership, and for those of you who are on with us for allowing me to have this opportunity to speak with you, even if it's remotely. And no question that this has been an extraordinarily difficult time for all of us. Sacrifices have been made by anybody. And in keeping with your first, I was the first woman president of the Iowa Medical Society, and I was the first in my family of 8 children ever to go to college. You see, my dad was a Master Sergeant in the Air Force. My mom had gotten a GED. All the kids went to public school. My 2 older brothers left home and went into the military. My older sister wasn't sure what she wanted to do. And at 15, I was severely burned. And during a very long hospitalization, decided I wanted to become a doctor. Now, prior to that, the thing I don't tell anybody, and I certainly don't tell my campaign team, is that when I did aptitude tests in middle school and early high school, they said I could be a bricklayer. Now, I have, in fact, laid brick and laid tile, but when I was hospitalized, decided to become a doctor. I came home, told my parents that, and they, like many parents, when their teenager has an idea that they think is harebrained, they try to dissuade you. And they were self-educated, very intelligent people, but they just thought higher education was out of reach for their children. And me, my idea of rebelling at 15, when my parents told me I couldn't do it, was to leave home at 16, get a job, enroll in community college, enlist in the Army at age 18. And I just kept working and going to school until I was able to get a degree in nursing, a master's in education, went to medical school, graduated, and then was able to go to the University of Iowa to do my residency in ophthalmology, and have been in Iowa. since that time. So for me, that idea of taking a risk and perseverance and tenacity, holding on to a goal, seeing it to its fulfillment, that's not my story alone. That's the story of every business person that's on this call. Everybody who has had an idea of something they thought could make it in the marketplace, or if they're a child of a business owner and growing into maturity and taking over that business, that's the goal and dream of all of us. And to me, that idea is worth fighting for. And that's why I'm running for Congress. I have never quit fighting for people's ability to have the opportunity to achieve their dream. And dreams aren't financial success. Often it's just knowing that you can do something, you can bring something to the marketplace, you can achieve something. It is often an internal motivation. And I think for me, that's an extremely important thing. And having traveled the world and see people who come to our country, both when I was on faculty at the University of Iowa and University of Michigan, and then in my own private career meeting with people, it doesn't matter where people are from, people come here because it is a place where you can achieve something through your merit. And I still find that this is one of the few places in the entire globe where that can happen. And I think that's worth every sacrifice to be able to achieve. Now, granted, I'm in medicine, and so people may think that that's not the same, but I did both academic medicine, military medicine, and then I had my own small private business. And business owners, face their own particular challenge. Most business owners I meet are tremendously supportive of their employees. They think their employees are their best asset, their most valuable asset. It's hard to hire people, to bring people on, train, interview people, keep them within a business, and then find the things that make people happy within a business and want to fulfill their highest potential. I actually brought lean techniques into the Department of Public Health when I was there, learning from my business colleagues about how to keep people motivated, how to keep them happy and fulfilling their potential, how to let them stop a line, if you will. In ours, it's a little bit different. But I think for those who are in business, if you've not been on the other side of the paycheck, meaning not the recipient of the paycheck, if you're the one that has to sign the paycheck, you often don't understand the challenges and the workload of a business owner. So it was a profound honor to be the recipient of the National Federation of Business Owners endorsement, something I value, having been a small business owner and work with a lot of small business owners. And those are the reasons I'm running for Congress. I think we can have accessible, affordable healthcare that still allows us to have choice. From the day we announced this campaign, we talked about trade that is free and fair and allows us to compete around the globe. We've talked about skills training and apprenticeships because we know not everybody wants to go to college nor has the aptitude to go to college. And we don't want to demean what it means to get a college degree or demean what it means to have a skill and a trade and to be able to go to the highest level of your craftsmanship. So skills training and apprenticeship, I think, is extremely important. And we talked about this back on October 1st when we launched the campaign. And then also we talked about accountability in government, holding government accountable, and government being trustworthy. I think that our government institutions, and when I was director of public health, I can tell you one of the things that I said to our staff was that for public health, credibility is the most important asset and attribute that we have. Because we have the ability to put people in quarantine voluntarily. And, I wasn't thinking I would be campaigning in the middle of the pandemic, but actually talked with my staff that we have to be trustworthy and we have to be credible. Therefore, we can't shortcut things because we want to achieve a certain goal. Credibility and trustworthiness is the most valuable commodity we have. And so today, never has that been more true. So it's a pleasure to be campaigning. It's a little strange to be campaigning in the middle of a pandemic. I wish I would have, bought stock in Zoom a year ago. But nonetheless, here we are, and it is an important time for business. And I think to that end, what I want to say is I've heard this narrative, and it's a narrative that I don't accept. And throughout this pandemic and throughout the derecho that you all are facing now, we didn't see much of that in Iowa City. This is not life versus the economy. This is life versus life. All of these lives matter. People's businesses matter. The jobs that they create matter. And it's an important topic that we all should be discussing, not in a finger pointing, not in a blame, but how do we emerge out of this? How do we emerge stronger? And how do we keep our economy going so that we can do all the things that we want to do as a nation?
Thank you for that. And I just want to remind everyone, if you'd like to put your questions in the chat box, I will get to them in time. But I wanted to just follow up on one thing that you said, and I was really glad to hear you say it. One of our members' biggest concern is the lack of bipartisan collaboration and really just the tone of politics today. And it seems like we're just kind of unable to work together for sort of the common good, the larger good. Can you tell us, in your political experience so far, how you've worked across the aisle? Can you give us some examples of that? And then can you talk a little bit about how you plan to continue that into the future?
Well, as coming into the state Senate for my first session, I was chair of human resources or human services, vice chair of veterans. I was also on commerce, appropriations, and state government committees. And so the first thing I did as bills were coming forward, there were bills from both sides of the aisle. Talked to my leadership on what their expectations were, and they said if it made good health policy, do it. And so for things to me that made good health policy, we did those. So we passed a bill for lawful permanent residents to be able to have a waiver. We had to require CMS or ask CMS for a waiver so that they could receive Medicaid early to get prenatal care. This was something generated from a physician at the University of Iowa. I don't want to mention names because I don't know what I'm allowed to do and what I'm not allowed to do, but you can ask some of your elected officials in the Iowa City area. It was a bill we worked on, we talked about, I discussed it with my caucus, we put it forward, and we ended up passing it in appropriations because we had a fiscal note from Medicaid that was way out of line with all of our understanding of what this bill would cost, and we found out why. But ultimately, we didn't get the waiver from CMS, but it's something that we did in a bipartisan fashion that to me was pro-woman, pro-legal immigrant, pro-life, pro-babies, pro-family. It made good health policy sense to do it. And ultimately, if you're a fiscal conservative, would ultimately save the state money by having less low birth weight infants and less premature infants that went into the NICU. We passed a bill on oral contraceptives behind the counter over age 18. We passed a bill for that got me the Legislator of the Year award from the Iowa Harm Reduction Coalition, which is not why I did it, but it was to have remove pre-authorization for medication-assisted treatment on Medicaid. So if you're a substance use abuser and you're trying to recover, that there should be no delay in getting access to medications that help you recover. And these aren't necessarily Republican things, they're not necessarily Democrat things. Although they may have been put forward by the opposite side of the aisle, they were good health policy sense that increased access to care, made it easier for providers to be able to care for their patients. There were things that ultimately could, in fact, save money if you're on the fiscally conservative side, but we did them. We passed a bill for trying to gear towards aiming prescription drug cost. It was on transparency and pharmacy benefit managers and the rebates. That's also a hot topic at the federal level. And Senator Ernst and Senator Grassley are both working on this. And I think that attention got me invited to the White House when President Trump signed an executive order on pricing transparency in healthcare, something that you all in the business arena probably wonder why we do not have pricing transparency in healthcare and why it's so convoluted, and it certainly is complex. But a lot of these things we did in a very bipartisan fashion, working together and working across the aisle. And I guess for me, it's as simple as the golden rule. Treat others how you want to be treated. I went into this knowing that we're in the majority, there are things we can get done, that we're not going to get done everything, but there are also good ideas, and good ideas aren't relegated to one side of the aisle or the other. And if you treat people how you want to be treated, I think you can achieve more. An interesting little tagline on that is when we passed the bill for oral contraceptives over age 18 behind the counter, and had a tremendous amount of support, both sides of the aisle. The next day, some of the news reports, one of my Republican, or not one, more than one of my Republican colleagues brought me the paper. And the photo in the paper was of a Democrat female senator, not of me, even though I ran the bill. And so I just looked at it and they said, well, you know, what do you think of this? And I said, you know, Ronald Reagan said that you can get a lot of stuff done if you don't care who gets the credit. So I think if you treat people with respect and dignity, you try to focus on the issue, not on the party, I think there's a lot of things that you can get done. And if you're focused on what the end result is, not who gets the credit, I think there are a lot of things that we can do across the aisle and get things done. And one of those that we're going to have to work across the aisle is infrastructure. We know that we need a big infrastructure bill. President Trump has talked about this. I am very excited to be able to work on an infrastructure bill should I get to Congress, because both we need it for our economy, we need it after this disruptions we've had with our natural disasters here within our state, and it's something that will help keep Iowa growing in the right directions.
Perfect. I love hearing the golden rule. I try to live by that myself too. So going back to healthcare, I wanted to just get to our first question, and I'm going to read it here. My company's health insurances increase over 20% per year and has since 2015. What cost $1 in 2015 costs over $2.50 today? How can we slow this rate of increase? What action steps will you advocate to slow these rising costs? And I think you touched on the cost of healthcare, and I hear this over and over again as being kind of the number one thing that our small businesses have to try to figure out in order to stay competitive with workforce. So can you talk a little bit about that and how you can kind of address that issue?
And it's interesting that even when I was on faculty at 2 universities, I can remember at the University of Michigan, we had a group of business owners come in. And so even 20 years ago, this was an issue at that time. How do you stay competitive? How do you stay competitive state by state? And globally, if you're a company that exports, how do you stay competitive if your healthcare costs are so high and you're competing against countries that either don't offer healthcare, and so that's not an issue in their staffing or pricing, or if you're competing with a country that does offer healthcare, and so that's not a cost that their company has to bear. And so it's a challenging issue. You know, in 2010, this issue was supposed to be really put aside. The Affordable Care Act was passed. It was supposed to lower premiums. And so I think what we saw was that premiums went up. There was more consolidation within the industry. In 2010, there were almost 50% of physician business practices that were private. Now that it's less than 20 physician practices or provider practices are owned by larger entities, larger physician practices or hospital-owned practices, and hospitals themselves have consolidated and has not reduced healthcare. You in business have competition within your field. And so you're offering, the competition is geared at giving a product at a certain price and a certain value. And I don't mean to say that healthcare is the same as is your business or other products, but certainly we do not have competition in healthcare in the way that other business types do. And we know that competition works in healthcare. And the reason I say that is I offered LASIK in my small practice in Ottumwa. And I had to rent my laser. I didn't have enough patients that I could purchase a laser. So I had to rent the laser. So that was a certain cost. So I looked at what my cost was. I looked at my area, which is not a wealthy area. It's the highest rate of unemployment, highest rate of poverty in Southeast Iowa. And so I looked at what I could offer it and basically offered a service for very little money, but to be able to prevent people from having to travel large distances. And it was a very successful practice that we were able to offer. And so we know that in plastic surgery, for instance, in LASIK, those things that are not covered by insurance, that competition does work in healthcare. And so it's something that we have continued to go down this road of a prepaid benefit plan rather than having people access health insurance or medical insurance in a way that allows them to control costs. I think one of the things that I found was a problem with the Affordable Care Act was the essential benefit package. And it was an expansive set of benefits and therefore increased the cost of healthcare policies. So I certainly think that there are ways that we can emphasize health savings accounts, especially for young people, allow them to tailor their health insurance in the way they want, purchase medical insurance across state lines. We need to emphasize that there's both health and there's medical insurance. Health, we have a lot to do with. So I've, had gained too much weight. I was getting a little too big for my clothes, and I didn't want to buy a new wardrobe. And I'm a doctor and a former director of public health. And I said, I need to start walking every day. I need to get in my 10,000 steps. I need to take my vitamin C. I need to go outside to get vitamin D. And especially with the pandemic going, all of those things I think have kept me healthy. But we're in charge of the health portion. And then we have insurance for the medical portion. So we've done a lot of laws, our certificate of need laws, our, trying to get transparency with transparency in pricing, which helps. And there are a lot of things that are elective, if you will, where we would have some control over pricing and looking for price in order to help keep down cost. And I know that's a very short answer to what is an extraordinarily long question. I can't remember who it was that said nothing costs so much or more than when it's free. And I don't remember who said that, but it's why I'm not a Medicare for All advocate. Yes, we would have care or the illusion of care, but we would lose choice, and with the cost that it would cost. I think the Medicare for All when said either 32 trillion or 52 trillion on Elizabeth Warren's plan, 32 trillion on Bernie Sanders' plan, that would close 52 critical access hospitals within our state. And 52 critical access hospitals, that means you've got rural communities that all would close under a plan such as that. And you would lose the choices that we currently have, and I don't think would be the type of Medicare that we currently have that seniors are enjoying.
Well, thank you for that. That it kind of leads me into my next question, which is, I got a question here about, the survival of our small businesses, especially in the service sector. But I want to just ask just a more general question about recovery and what your ideas are around helping support especially some of our industries that have been especially impacted. Like I mentioned, kind of our hotels and restaurants. What are your ideas around, recovery for those businesses?
Yeah, certainly the hospitality, travel, and leisure industries have been disproportionately impacted. And we see that as states have cases, the first thing they do is shut down bars, restaurants, or close those. I think the approach to the pandemic, until we began to know more, I think the approach was appropriate. I think it was appropriate to have a closure of businesses until we learned more about the vaccine. And as we've learned who are the vulnerable groups, who are the most likely to die, then I think you have to reopen the economy, allow people to take risks for how much exposure they want. But that also requires transparency in government at the state level, at the federal level. People have to have information. So I am a strong proponent of putting out the information so people know what the risk is, and then how they can protect themselves from the risk, and then allow us to reopen our economy. As I said at the beginning, one of the narratives that I've heard in the media a lot is that this is life versus the economy. This is not life versus life. If anybody knows a small business owner, and I've talked with them, I help them get PPP, I help them get PPE, I have helped people to navigate unemployment insurance, stimulus checks, as a state senator. And honestly, it's heartbreaking. It's heartbreaking for someone to have started a business. Some of them started their business last year. Someone 5 years ago or 7 years ago, they have poured their heart and soul. I don't mean to get emotional, but I can put this in the context of my own struggles trying to get into medical school as one of 8 kids. It's just heartbreaking to have your business fail not because you didn't offer a good product or a good service or you didn't work hard enough, but because the government tells you you have to close. So we need to allow businesses to open, and we need to provide them guidance for how they open, whether it's wearing masks, whether it's putting up shields, whether it's social distancing, whether it's helping us to get a vaccine faster, whether it's allowing people to who are younger, who are least likely to die. But we need to reopen our economy and be transparent with information, how to protect ourselves, and that includes healthy behaviors. Very important. Obesity is a huge risk factor with which we don't hear a lot about. Obesity, diabetes, heart disease, age. There are risk factors. We know that skin color is a risk factor, but we don't know if it's poverty or if it's vitamin D. I've read a lot about vitamin D insufficiency and low vitamin D, so we should be testing individuals for vitamin D. There's so much that I think that we can do to navigate through this and help us to grow out of this. But I do not think closing down the economy again is a good idea, and for precisely the reason you mentioned.
Thank you. And just to kind of follow up on that question, one of the things that I think small businesses need is just communication. I think with this last bar and restaurant closure, they got 6 hours. Can you just talk a little bit about a long-term recovery strategy so that there is, I think all businesses need they need to know what's ahead for them. So how can we develop a long-term strategy? Like you said, the vaccination probably won't be around until early next year. And then before we all get vaccinated, it's probably going to be into the summer of next year. So can you talk a little bit about what is that long-term strategy? How can we add a little bit more predictability into the process?
So I think if we can think back to the beginning of the pandemic, when closures were suggested and recommended, and because we're a federalist society, it was recommended that at the federal level, and then states, and Iowa was a state actually that closed actually early. So it was March 16th. I remember we're in session and we were going to shut down session. We were going to go into a pause. And the next day, the governor, did the public health disaster proclamation. And so I think we can all be accused of not communicating well enough. My husband will tell you that even though we just celebrated our 37th anniversary, I do not always communicate things as well as I should. But I certainly think when it comes to school closure, school reopening, business closure, what's on tap, that more information needs to be given at an earlier pace, more communication. I think we can all be guilty of that from the local level all the way up to the federal level. And I would like to see more transparency and more communication. And maybe it opens up to criticism, I'm not sure, but I do think that there needs to be more communication and more two-way communication in that vein. So thank you for that. The other thing is, I think, again, going back to the initial pandemic, why did we close down? One, we didn't know enough about the virus, but two, it was because we were trying to prevent a surge in hospitalizations. And so when we look at information, the number of cases should not be what drives us to close something or recommend a closure. It should be what's the hospital capacity, what's the ventilator capacity, and ventilators, as we now know, ended up not being a major factor. And that was because why? Because as providers, physicians, nurse practitioners, as providers, doctors learned how to treat the disease. We found that putting people on ventilators sometimes was counterintuitive and what we need, not what we needed, that they needed oxygenation. And I had done a paper, an op-ed piece, gosh, I think it was back in April, suggesting that we could send people home with pulse oximeters to monitor oxygen and home oxygen, and not everybody would have to be in the hospital. I'm not sure it got published or not, but the idea was there that we need to think about other ways to treat the disease so we don't have a surge in hospitalization and it puts hospital workers at risk. But if people could be managed at home, they should be managed at home where they're not putting anybody else at risk because they have the disease. The purpose of the vaccination is to get what's herd immunity. And what we don't know about COVID-19 is at what level of the population who has contracted and recovered gets herd immunity. So we need to look at what's the number of positives of the total number of people tested, who's tested, what's the hospital capacity, what's ventilation capacity, ICU capacity, and then, you know, other treatments that may, ivermectin, does that work? Interferon, does that work? There's all of this thing that's happening all at the same time medically that we need to be able to look at, dissect through, and then determine, you know, how can we treat people in the most effective way possible. Early on in the pandemic, I had spoken to our caucus and the governor about having a medical reserve task force using my time in the military, and that needed to be done now. The governor did that with licensing, talked about increasing funding for public health. We did get increased funding for a laboratory capacity, the state hygienic lab for testing. We do need more testing. We need more serology testing. And we're doing, I think, I read over the weekend how much testing has been done, and I can't remember the figure. It was astounding, in the millions of the tests that have been done in the United States. But those are the numbers that we have to look at, not just solely the number of cases. The number of cases don't tell you everything, and I don't think is a basis for closing businesses. But if businesses know what the marker is and they can follow that information, then I think it helps business. It's a way to communicate to business without calling and saying, you know, our numbers are increasing, so we're going to close down bars and restaurants, versus how can we work together to reduce the number of positives if it's that college students are getting together and they're causing the, you know, they're congregating at bars and they're causing our case numbers to rise. So I think that level of communication with where it's a dialogue and a conversation on help us to meet this goal. How do we help you to help us to lower the number of caseloads until we get a vaccine? And then again, the vaccine, the purpose of the vaccine is enough people get the vaccine that we have herd immunity. For measles, typically in public health, we say it's 70 to 80% of the population has to have contracted. With influenza, it's one of those weird things, and the regular cold or coronavirus regular cold, you know, for those we have some immunity, but we don't have complete immunity, which is why we have a vaccination. And we're coming into influenza season. So that adds a whole new layer for business owners to struggle with, I think. But if communication, information, guidance for you on how to protect the public and still afford your business, wearing masks, social distancing, I have no issues with those things. And when I go places, I was asked a question about voting this fall, and if someone wanted to vote at the poll, and if their polling place was at a school and the school mandated mask, did they have to wear a mask? And I said, legally, you may not have to wear a mask, but you should wear a mask. So I think that, you know, protecting, it's hard to tell people who are healthy that you should wear a mask. You do it not to protect yourself, but you do it to reduce the viral load to protect other people, even if you think you don't have the virus. So I think all of those things are important as we go forward.
Well, thank you. And I have one last remaining question here before we get to your closing remarks. But our communities have been incredibly hard hit, and it will take years to recover. A long-term strategy needs to be put in place to help us rebuild stronger and prepare for the next disaster. In addition to safe roads, bridges, reliable transit systems, accessible airports and broadbands, parks have never been more important, right? Natural spaces, and of course, affordable childcare. So we need to look into the future to help our state and nation weather the next crisis. Can you speak to this and tell us what are your long-term recovery goals for communities? You mentioned infrastructure earlier. So what are your long-term goals for us as we rebuild our communities?
So I'm not sure I remember everything, but so it's interesting. Senator Edler, Jeff Edler, and I were working at the state level on childcare, increasing childcare that for lower income people, the step where you have a certain income, you get to a certain income, and then you lose your benefits. So we were working on that, and we found that we really hit a roadblock because of it's a federal state partnership. So I think working on the federal level, to be able to work on the state level, I already know I have willing partners on the state level. That needs to be a collaboration so that we do have childcare, that we end this step, because the goal is to help people reach their potential. We want everybody to be able to emerge out of poverty and to fulfill their potential. And I don't know what that is, And somebody may have the next idea for the next great product, and I don't, or the best way to build a road, and I don't have that information, but I do trust that people have information and have knowledge and have potential that's being untapped. So I think on the federal state level, there are things that we can do on childcare, accessible childcare, so that it helps both women and men get back to work in a manner that goes with schools, reopening schools, keeping children safe at the same time as you reopen schools. There are other things that we did on the state level, and I can't remember everything you said, so I apologize for that, but we passed state legislation looking at concurrent enrollment, so that someone that's in high school can do more concurrent enrollment for AP classes, making sure that they're available in rural areas. I passed the broadband bill, and I lovingly called it AKA, please get Senator Miller-Meeks better broadband and internet access so her children would come visit more. And that's because I'm in a rural area. I could not do remote access electronic health records because my internet wasn't good enough. I couldn't download information. And that was a huge impediment, which meant I spent hours at a workplace when I could have been at home doing that work. And you know, if I had little children, that would have been important to me to be able to be at home to access that. So the broadband infrastructure is critically important to our state. I know Governor Reynolds is going to use some of the COVID-19 money to be able to do that. We will probably need a phase 4 package that helps, as you mentioned earlier, restaurant, bars, the hospitality. I know several major airlines have already declared bankruptcy, several major hospitality industries, hotel industries have declared bankruptcy. We will probably need a phase 4 package to get out of this. But I think we've also learned a lot about COVID-19 and how to respond to the pandemic. I did an op-ed back at the end of April on opening hospitals earlier, and that hospitals did not need to shut down, did not need to stop elective surgery, that certainly hospitals, doctors, infectious disease personnel knew how to respond to viruses and pandemics and how they could safely reopen. I've also done an op-ed on how to prepare for the next pandemic as we emerge out of this one. What things that we need to do in harnessing both my legislative experience, my healthcare experience, public health and military experience, pre-positioning supplies, getting supply chain diversified, not relying upon China or the Chinese Communist Party for personal protective equipment, for pharmaceuticals, bring that manufacturing back online. How to have companies. So one of the things that was the strategic stockpile, some of the things were molded, they were not available, they couldn't be used because they had sat in a warehouse for 15 years since the H1N1. But how to work with companies to pay them to store that equipment and then reintroduce it into their supply chain, so you have a continuous supply chain and continual equipment, and they store 6 months supply. So we know we have a supply that will be able to help both our states and our country, our nation as a whole. So it's little things like that, I think, that really are going to help us to not only emerge out of this pandemic, but out of the next one. We need leaders who solve problems, who are willing to listen, who are willing to gather people into consensus, gain information, put that forward into policy and plans, and plan ahead.
Excellent, thank you. So Senator Miller-Meeks, thank you so much for being with us today. What one or two thoughts do you want to leave us with this afternoon?
I would say none of us, I knew that eventually there would be another pandemic, but like H1N1 affected 60 million Americans, but it was not as fatal as COVID-19. So we knew that eventually there would be another pandemic, but I don't think anybody expected that this global pandemic would be such as it is. But it's an odd time to be running for office when the skill set that's necessary, having military experience, public health experience, physician, small business experience, and tenacity, grit, and the willingness to take a risk and work in a bipartisan fashion. That is a skill set that is desperately needed in Congress right now. And I think that you have one candidate that has all of those skill sets, willing to listen, willing to execute, and make things happen. And so I, again, appreciate the opportunity to speak with you and your members, the opportunity to run. It's really a strange time to be running for office, but I think sometimes we're put in a position to do things when we're most needed. And coming from just a lifetime of service, I think I'm being called to be put into service now. I appreciate the opportunity. People can visit my website at millermeeks2020.com. And then I really appreciate all that you all have done as business owners. All the things that we do, all the money we get to spend at a state and a local, state, and a federal level comes because people are willing to set up a business, employ people. All of that goes into tax revenue, which goes into helping to fund the programs that we all feel valuable. So thank you very much for your willingness to own, operate, and keep a business going, especially during these difficult times.
Thank you. Well, I want to thank you one last time for joining us today. I also want to thank our attendees for the great questions and for joining us. As I mentioned earlier, we will be posting this recording on the advocacy section of our website, iowacity.area.com. Thanks everyone for joining us today. Stay safe and stay healthy and have a great day.
Thank you all very much. Be safe and be well.